In this video, I will talk about 10 important questions every woman should ask their gynecologist from their 30s to their 50s. Stay tuned to learn more about this subject. Welcome to Women's Healthcare Answers, and this is Jeff McQueary. I am a practicing gynecologist in Tennessee. I want to focus on you, especially if your gynecologic problems are dominating your life and you want to take back control. You can with answers and solutions I will give you. But today I want to talk about 10 important questions every woman should ask their gynecologist between the ages of 30 and 50. This is a very important time of your life, and I know you all have these questions. Stay till the end for a special bonus question and answer. Let's get started. Number 1, when should I get my first mammogram? It's a good question. The risk for getting breast cancer in the United States is about 12%. And that is really why early detection with mammograms is so important. According to the American Cancer Society, women between the ages of 40 and 44 have really an option to start screening with mammograms every year. I typically recommend it. Women between the ages of 45 and 54 should get mammograms every year. Women's 55 and older can switch to a mammogram every other year, or they can choose to continue yearly mammograms. Screening should continue as long as a woman is in good health and is expected to live at least 10 more years. The recommendations to have mammograms every year or two after 55 is okay, but I prefer every year because I would hate to miss an early cancer on mammogram and for it to be 2 years before that was rediscovered. An age earlier than 40 is generally too young to begin screening for cancer unless you really know you have genetic mutations such as BRCA, which is called BRCA, or on your examination you truly have a lump. This is why breast self-examination is so important. Number 2, how can I reduce my risk of breast cancer? Always notify your healthcare provider if you have any changes in your breast, such as a pain, a lump, nipple discharge, or redness. Healthcare professionals often use a tool to predict breast cancer risk called the Gale model. This is typically for women over the age of 35 and takes into account your family history and personal history as well as breast cancers that you personally have had in your family. It also takes into account your race and age, when you had your first period, personal history of breast biopsy, and the age when you gave birth to your first child. There's a version of this test that you can take at cancer.gov. Certainly, discuss any information you get from this assessment or if you have any abnormalities such as a breast lump with your gynecologist. Number 3, is it normal to have painful sex or pain in my pelvic area? This is interesting because it is, according to a Princeton University study, 75% of women will experience pain during sex at some point in their lives. The changes can be very minor or severe and can be a debilitating problem. But many minor issues can cause pain during intercourse, such as infections or poor lubrication. But serious issues, such as endometriosis, are very common in this time period. And scar tissue and adhesions from previous surgeries can cause serious pain in the pelvic area. So it's really important for your symptoms not to be dismissed by your doctor. I'll emphasize that again. The severity of your symptoms should not be dismissed by your doctor. I've had many patients who came to me when their doctor told them that their symptoms were normal. It would be best to see your physician and discuss how bad these problems have become and get a diagnosis and treatment right away. It definitely can be. Number 4, do I need to do Kegels exercises and how do I do them? Kegels exercises are pelvic floor muscle exercises. These are often not done well, but there's a lot of information on the internet about pelvic floor exercises and how you can use those today. Weak pelvic muscles later in life can lead to urinary incontinence and pelvic organ prolapse, which would be best to prevent. I think you'd agree. MayoClinic.org has a good explanation online of how to do Kegels exercises. If you don't think you're doing them correctly, you could be doing more harm than good. So visiting your physician or a pelvic floor physical therapist may allow them to show you how to do them better. Number 5, is it normal to have vaginal discharge, itching, or odor? I definitely think this is a controversial issue, but it is clear that a milky or clear discharge is completely normal and should be of no concern. The body normally washes old cells from your vaginal area, and this creates a normal environment. But every woman has a different discharge and a smell, which often depends on what you eat or drink. Strong foods, spices, and alcohol sneak into the vaginal secretions and create intense smells. But if the discharge changes in color, substantially increases in volume, severely itches, or has a fishy odor, it could be of concern, such as bacterial vaginosis, trichomonas, or a yeast infection, but cancer is even a possibility. So your physician can diagnose and treat any of these issues. Number 6, why are my periods so heavy or irregular? And really, what's normal? So periods, again, are typically every 28 days, with that interval being between 21 and 35 being normal, and typically periods lasting 2 to 7 days. They can fluctuate from light to heavy based upon hormones, activity level, and diet. But extremely heavy periods, which can be caused by many things, it can be serious problems. So if you're having to double up on your pads, as well as tampons, change them every 2 hours, you have or had anemia, or your periods lasted more than 7 days. This is a medical condition called menorrhagia. This can happen at any time in your life, and irregular periods can happen as well. But after 30, you must be concerned about fibroids, uterine muscle tumors that can be benign or cancerous, endometrial hyperplasia, which is a precancerous thickening of the uterine lining, poor ovulation, possibly from even premenopause, or even cancer as well. So there can be some serious problems here and not so serious, but they need to be addressed with your doctor. There are good medical evaluations and treatments for bleeding issues. Number 7, is there a medical reason why my sex drive is so low, and why did it change as I aged? Well, the technical term for low libido, you should talk to your doctor about it, especially if this is having an adverse effect on your relationship or your own mental health. This can be secondary to hormonal imbalance, which may become more prevalent with aging. Medications can cause this, diabetes, high blood pressure, depression, stress, or potentially even the approach of menopause. Lifestyle changes and even hormones can help enhance your sex life. It is best to talk with your gynecologist to identify your particular issues and to treat you. If you like the content so far, hit the like button and subscribe so you won't miss any of my new medical videos coming out every week. Now to number 8. What is a urinary tract infection, and how do I know for sure that I have it? A burning sensation when you void, as well as increasing urgency and frequency, may be the symptoms of a urinary tract infection or bladder infection, and they are the same thing. A urine odor may also be present. Certainly, increase your fluids, drink more fluids, but if the symptoms persist, you may need treatment with antibiotics. Often bladder infections can also be associated with sex. Antibiotics can be given to help you prevent these infections from reoccurring. Number 9, are douches needed or safe to use? Douches used to be used as birth control even in the 40s to 60s. The vaginal discharge you produce, as we talked about earlier, is your normal body. And that's literally your normal body douche. And this is your natural self-cleaning system. So using these type of products, which may be containing vinegar, baking soda, and iodine, can actually wipe out the good bacteria that keep the abnormal bacteria in check. You can actually cause an infection from the use of a douche because the normal bacteria can no longer protect you from the abnormal ones. There was even some evidence that you are twice as likely to develop ovarian cancer if you use a douche consistently. So I certainly don't recommend it. And there are absolutely no health benefits to adopting that technique. Number 10. Should I be concerned about a bump on my vulvar area, which is the outside of the vagina? I know that you are concerned and alarmed to find any bump in the vulvar area. This is the outside of the vagina, and there are normal reasons for this, such as shaving and having an ingrown or infected hair. It could also be a cyst or a pimple. Certainly other major issues such as genital warts and herpes can be a possibility, and even rarely precancer or cancerous changes. Certainly have this looked at by a gynecologist to determine if it's serious or not, but I would definitely go. Now we're at the end, but I promised you one more if you stayed, so here's your bonus. Bonus question is there something that can keep my mood and cravings under control during PMS? You know, sometimes PMS symptoms can be more intense and worse in the 30s and 40s. There can be hormonal changes that are premenstrual that can lead to a lot of cravings and mood changes. But what is truly not normal is being unable to function with the depressed and hopeless feelings and the anger you can feel during that time. You really need to talk to your physician about options that may actually really help you with these problems on a monthly basis. Definite antidepressant medications can be very helpful. So this has been a series of videos exploring a few of the right questions to ask your gynecologist. I hope you have enjoyed it, because I've certainly enjoyed being here with you. But please comment so I can know what is bothering you and what problems are on your mind. I would love to help you solve your problems at Women's Healthcare Answers. Remember, this video is meant for information purposes only. Please consult your own healthcare provider, but it is okay to reference the information I gave you.